Hey guys, hey, how are you guys doing? It's adjourned because today is Saturday and I am definitely doing. I had to break my mother's rule just for today. I'm running a little late and I don't have a whole lot of time. Everybody else is asleep. I told you it's really hard for me to make videos when everybody else is awake. So I try really hard not to, just because I feel like I can't be myself, and then it feels like somebody's kind of eavesdropping, you know how like when you're sitting there talking on the phone to somebody and then like if your significant other or somebody else is in the room and they're listening. It's weird to me. I don't know why. I made some freaky edamame for me so you guys can see it. I'll take a picture of it. So you're gonna ask me, what is the recipe, Nirvana? Okay, so I get them in the pods, and I get them in my local grocery store, my commissary. Nom nom. Nom 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 nom. That's all you do. Okay. So they come frozen. I put them in a pan. Okay, still frozen in a pan. I turn the pan on probably like medium. And then all I do is I'm warming them up. They're pretty much already done. You know what I'm saying? Like you could eat them if you just thaw them. You can eat them raw. And I actually like them cold. So I like to make them like this and then make them cold. So simple ingredients. It's garlic. Big chunks of garlic. You know how you can get the garlic cloves over in the refrigerated aisle? And chop those up. So salt, garlic cloves, avocado oil, or whatever kind of oil you like. I choose avocado oil because I know it's good for me, and you use as much as you think that you need. I probably use for an entire bag maybe like 3 or 4 tablespoons. And remember, you're not really eating all of that. You're just eating the pods and kind of just sucking the stuff off of it. I'm trying to get you guys settled over here. There we go. That's better. Okay. So anywho. And I'm just warming them up, and then I put this, I think it's called 5 spice chili powder. I think it's Chinese. When I don't even have the bag, so I think it might be 7 spice or something like that. It's just hot chili flakes. Like Jody will probably write it down because she's the one who gave me a little thing of it. I'm almost completely out. It's that good. So that, garlic, salt. That's it. That's all I put on it. That's all. And you just warm it up until it's done, until they're no longer cold. And then I like to put these in the fridge, get them cold for the next day, and they're just as good. These are fantastic snacks. Don't mind if I do. So I went out with the hubby today. My mother-in-law has Meniere's disease, which is an inner ear issue. Salt, stress and stuff can bring it on, and it causes vertigo and vomiting and stuff like that. And she's been suffering with that for a couple of years. Still not naked. And also, today she went to her doctor and, just to see if everything's okay. And it's just bothering her a little bit, and she's afraid she's going to have an attack. So, some good vibes would be nice. I don't know what else to say, guys. Like, I'm okay. Things are fine. My pain level is around a 5-6. I'm still dealing with my hip, and they said for a couple of days it would still hurt. And I'm kind of wah. And then it will decrease in pain, but not make it go all the way away. Next month on the 11th, I get my ablation done on my spine, and they said as well, it'll take a couple days to feel better, but it'll only be 50%. So I'm never going to be 100%, but we're going to try and do the best I can. And I thought I would talk to you guys about pain management just because there's a lot that goes on with pain management. And a lot of times when you tell people you're in pain management, they instantly look at you like you're an addict. And that aggravates the shit out of me, because the reason there is pain management is because lots of people live in chronic pain. Lots of people have issues or have, issues with pain, and it's better for them to be with a team of somebody who understands and can help manage that pain than it is for them to try to manage it on their own and suffer alone. So just because somebody tells you that they go into pain management does not mean that they are an addict. It doesn't mean that they should be ashamed or feel bad about it, because I don't. My pain doctor is fantastic. He's really smart. We have tried several different kind of medications now, just trying to figure one that doesn't make me and doesn't make me sick and doesn't make me sick to my stomach, and that I can absorb, because as a gastric bypass patient, I've told you guys before, with pills, we have a harder time absorbing the entire thing, especially something that's supposed to last a couple of hours. The way our body is rerouted, and people with the DS as well, you're not going to absorb that amount of medication that you're given, and you're not going to get the entire full amount because of just the way it sits in your system. So I'm a little bit more trickier. What they do for me is that, I go in, we talk about my pain, we talk about procedures, we talk about what kind of medications I've taken in the past. He looks over my work. He asks me, what are my goals? What would I like? What pain level can I live with? And of course they do look for people who are addicts. They count your medication when you come in. To see how much you took last month. If you call and ask for more medication, they make you come in and sit down and talk to them. They look into your eyes. They want to make sure that you're coherent. And of course, there's blood tests and pee tests that you have to do to make sure that you're not taking all kinds of crazy stuff. So it's a safe avenue if you have chronic pain. Do not be afraid to ask for help, because why would you want to live in horrific pain when you can get help? And don't be afraid to tell them if you are taking this medication, if you are afraid that you're going to be addicted to this medication, or that you feel like you're needing to take an unhealthy amount of medication. They will definitely help titrate you down and maybe switch you to something else that doesn't. So do not be afraid to switch medications. Don't be afraid to be honest. Don't be afraid to tell people that you're hurting. It is better in the long run for you to be honest and upfront than it is for you to hide it and then, keep going to the ER all the time and, only do it like in certain times. It's just much better in the long run that way. So, and it looks like my mother-in-law is up. Other than that, guys, the dogs always make a shit ton of noise when they're coming down the stairs. I had to go through my regular doctor to finally get to see a pain management specialist, and then I've been working with the pain management specialist for a couple weeks now. I've already had my first injection, and that was wonderful. I also am, like I said, had I not gone to him, I would not have known about the ablation for my back. We wouldn't be talking about the different kind of medications, because when you just go to your primary doctor, when you just go, that route, and they're really not able to give you the kind of medicine that you need, because that's not their area of expertise. You need somebody who is really, who knows all the different kind of medications, who knows the kinds of medications you can take, and what interactions with what. That's what they're there for. They're there to help you live a better life. And I really kind of wanted to talk about that, because there's been lots of questions. And like I said, I started off with my regular doctor once we knew my hip was kind of crappy. And then from there I had x-rays, and then, she gave me some Norcos, and I was kind of And then I I think like 3 months later, she said, you know what, why don't we take it to the professionals? And then I've been seeing Dr. White, and he's fantastic. Fantastic. Trying to think if there's anything else I need to tell you guys today. I don't think so. I have some pretty pictures that I took today. One specifically that I was just gonna delete it. A lot of times I will take it like 4 or 5 different pictures, and I'll look at them, and if they're not up to snuff, if they're not to my satisfaction, if I don't think that I'll look well in them, I'll just throw them away. And today was one of those days I was like, you know what? I'm not, you know, there's a lot of lumps, there's a lot of bumps, there's a lot of stretch marks, there's a lot of, you know, skin, there's a lot of meats that, you know, you can see. But that's what I look like. You know, if you were to take a candid picture of me, I would not see, you know, you would not see anything different. You would see me the way I look, not as a special pose, not if I'm sucking it in or anything like that, you know. I think it's important to understand what you really, really look like and learn to embrace that, because, you know, I'm not perfect, and I don't wear shapewear, which I probably should, and I don't always like the way I look in all my pictures, but that's okay. You know what I'm saying? That's all right. It's okay for me to not like the way I look. But at the end of the day, I have to love who I am, because right now I'm doing the best I can. I have not weighed myself since the last time. I don't know. I'm hoping I haven't gained any more. I hope it's going to start coming off. I'm going to start taking an over-counter diuretic and see if I can't get some of it off. I feel it in my hands and my feet, and I can see it in my face, and I don't want to get weighed again until I have at least most of it off. A couple pounds is okay. 10 pounds, not so much. So I love you, beautiful, gorgeous, amazing faces. I really hope everybody's having a great, great weekend, and I will try to talk to you tomorrow. Mwah. Bye.